Regina, and good afternoon, everyone. Of course, as a member of the Cochrane Insurance Medicine, this is a very happy day for me as well, and I'm very happy that I could join in on the celebration. And now I'm going to talk from a Swedish perspective a little bit about the professional development in insurance medicine. So first of all, I thought that I would give you a small background context about Sweden. So in Sweden, in contrast to some countries, insurance medicine is, as Regina said, not a specialty, but all physicians can sickness certify. So it's not a role just for GPs as it is in some countries, but all physicians take this task. And that also sort of course, gives that it's a very common task. And in most cases, one would, as a patient, need a sick leave certificate after the eighth day of an absence. So the first week you self-certify. And to look into how physicians perceive this role, we have surveyed the physicians in Sweden 4 times. And the last time in 2017, we found that the wide majority of the physicians stated that sick leave certification was an important task, and how they worked with this task was important for their patients. And we also found that the physicians in orthopedic clinics had the highest proportions of sickness certifying consultations. So they were in the highest category, and that was the highest proportion that had at least consultations 6 times per week or more. About half of the physicians stated that it was problematic to assess the patient's work capacity, and that is quite general when you also survey physicians in the rest of Europe. And also that longer sick leave spells were in general experienced as significantly more problematic, and that is quite easy to understand. But what is it then that is problematic? And well, as you see here, the dark blue is that something is very problematic, and the blue one is fairly problematic. So this is basically all problematic. And they found assessing function, assessing work capacity, and especially assessing work capacity among unemployed. So when you didn't have the sort of work tasks to compare to, you didn't know really where you were relating the function to, that was difficult. To make a prognosis of work capacity, prolongation of other physician certificates when you, for example, start in another clinic and then you are transferred to your primary health care center or something like that, or the first physician stops being responsible for you. To manage the 2 roles as a physician, and with the 2 roles here, I mean both being the ones certifying something in relation to other authorities, as you do on a sick leave certificate, and also at the same time being the treating physician. And the last one, which is very unpopular, of course, among the physician, is when the social insurance agency asks for more information on the certificate. So they basically bounce it back to you as a physician, and the patient interprets it as you were a bad physician that didn't know what to write in the certificate. So in general, during the education for board specialty, there is, for all specialties, regardless of where you're going, a mandatory objective concerning insurance medicine. So all physicians have in some way having to have some sort of quite advanced training in this. But it's not, this objective can be achieved in different ways. You can, for example, attend seminars, you can do short web-based courses, you can do like a day course here and another day course somewhere else. And we're currently also developing a new web-based course for specialty training physicians. Now I'm going to tell you about quite an ambitious program that we have had at our division at Karolinska Institutet for some years. We don't have it planned right now, but we've had have had it sort of ongoing with a couple of years in between for quite some years now. And it's really a more sort of advanced level. So all the physicians had to have a already achieved specialty, some sort of board specialty, or been in sort of the later stages of training. The program was 3 semesters part-time, and we aimed it towards physicians with special interests in insurance medicine, wanting to work with more like overarching questions about sickness absence and things like that. And afterwards, we have annual meetings with our alumni, all the former and current students are invited to have small seminars where we cover sort of what's new and what's happening in research and in Europe and things like that. So that's been a very well received program. And the themes covered in this program is praxis, science and research, relevant laws, rules and regulations, organization of relevant parts of society. So sometimes you certify things, but not towards the social insurance agency, which is the authority paying for your sickness absence in Sweden. But it can, for example, be to the unemployment office, or it could be social services or something like that as well. Or private insurance, of course. And then also covering different aspects of sick leave certification process and management. And one of the themes sort of relating to Cochrane Insurance Medicine is the days where we cover searching for new evidence. And so that part of the training involves library training, different databases and which search terms to use, and they get to sort of train that, and they get assignments to search for all the evidence that's available for a certain diagnosis. So, and then we compile them all over the years, all these sort of like, what's the evidence actually out there? And which is quite an enlightening exercise, because we compare them then to the national sick leave guidelines, which we have, and then to see like, well, what do they base these like 8 weeks of proposed sick leave absence for this diagnosis? What do they actually base that on? What research is actually out there? And what they come up with is that in most cases, the research out there is pretty slim. So, and then we also have lectures about systematic reviews and how to evidence grade things, and the group work, and where they also discuss the quality and the methods used in different reviews. And so what do the students actually think about this exercise and about searching for evidence? And I think that these sort of statements that all steps are experienced as difficult and confusing, there are very few clear answers, they can't really put the papers they find in context with what they actually want and like an answer to. And it's a big challenge that you can't find just one paper and that explains everything. And they have great difficulties in differentiating between the problems in the original studies compiled in the systematic reviews and the problems in the systematic reviews. And they can't really get a grasp of the difference between Cochrane library. If you search on PubMed, what's different? And if you just Google it, what's the difference? Is there some sort of quality difference? That's sort of a mystery, obviously. So it's very much this, but I did a search, and that's a search, it's a search. And I actually think that these sort of, how you perceive this is actually quite generalizable. I don't think this is unique to Sweden. And so to move on, we also have research education in insurance medicine, and we have for very many years had a course in sickness absence research, theories, methods, and concepts at Karolinska Institutet, which is a PhD course and it's open for international students as well. It's a 3 weeks course with sort of a gap in between, so 1.5 there and 1.5 week a couple of weeks later, and with the aim of providing competence about the current research on sickness absence, different types of study design, and very much looking at this problem from different specific disciplines, what the different specific disciplines have, because all disciplines have their own sort of assumptions that are very sort of well established that you don't really think about. And when you read this is a very interdisciplinary subject, then like how does the other disciplines think about this, and what are the assumptions that I need to be aware of when I look at the different results from different disciplines. And then we also have this work within a course within the NIVA education organization. So that's a Nordic collaboration, but it's also open for international students, where we have a work disability prevention course, bridging research and practice. And that's scheduled, we had to postpone it this year, so it's scheduled for June next week. It's a 1-week course and it will be held in Denmark. And in that course, we cover work disability prevention, and it's a bit more focused towards intervention research and the different socio-political challenges when you move one intervention into another system. And so it also includes the implementation of evidence-based practice and how you could sort of adapt that to different socio-political systems. And then I also wanted to mention some regional initiatives. So this is from Stockholm. There are a couple of other initiatives around Sweden. They look a bit different across different regions, but of course Stockholm is quite a big region, where they have established 3 knowledge centers of insurance medicine. And our goal is to map the knowledge needs and provide training in insurance medicine to all healthcare personnel. So this is an initiative that provides training not only to physicians, but to all healthcare personnel. And thinking that even though it's the physician that writes the certificate and sort of make the assessment formally, it's a great importance for everyone around the patient to talk about recovery, return to work, sickness absence in the same way. And so this is an initiative to sort of capture all of that. But of course, many of the courses are directed directly to physicians. And so there's one knowledge center for primary healthcare and one for psychiatry. And that's the sort of the biggest bulk of all the problematic sickness absence cases, and where like a large proportion of the sickness absence is originated. But then we also have one knowledge center that covers basically everything else, which is, well, all other specialized care and how you deal with these questions in hospitals and things like that. So that was all I wanted to say. Thank you so much.